Hello and welcome to Autism Specialty Care Education Series, which has been brought to you by India Autism Center and NeurAbilities Healthcare. Through this webinar series, we hope to cover a wide range of topics and provide comprehensive evidence-based information to assist educators and families in developing effective educational programming for their children and students with ASD. I'm Srirupa Chakravarthi, Assistant Manager at India Autism Center, a first of its kind integrative community project coming up in Bengal. You can know more about it by clicking on the links in the chat box or following our social media pages. I'll also be attaching India Autism Center's brochure for your perusal. We also have here with us Sandra Bean Lewis, Director of Marketing and Community Affairs at NeurAbilities Healthcare, which brings together the experts needed to provide evaluation, diagnosis, and treatment for individuals across the lifespan with neurological, behavioral, developmental, and cognitive concerns. This webinar series highlights many of the specialty care services of NeurAbilities and the experts who work together to bring patients of all ages personalized care. Ms. Kathleen currently serves as CEO of NeurAbilities, a healthcare organization where she is charged with increasing clinical outcomes by implementing an interdisciplinary model of intervention including neurology, neuropsychology, behavior analysis, speech and language, and occupational therapy services. During her tenure at Temple University and the University of North Texas, where she received her Master of Science degree in Behavior Analysis, Ms. Stengel implemented ABA treatment programs for children with autism, as well as developed and implemented caretaker training programs to allow children to be successful within their family unit. She maintains a unique skill set in providing high quality care through standardized and replicable intervention models. In addition, Ms. Stengel is skilled in OBN and ensures that systems are implemented from the hiring and training of staff to budget development and long-range planning to ensure that clinical outcomes are maximized. Kaori Nepo, BCBA doctorate, is the Director of Behavior Sciences in Pennsylvania. Dr. Nepo manages all-in-home, in-clinic and community-applied behavior analysis, diagnostic and treatment services in the state of Pennsylvania for NeurAbilities Healthcare. This includes the oversight, implementation and development of the new state-of-the-art Autism Treatment Center in King of Prussia, PA. Dr. Nepo has worked in the field of behavior analysis for over 20 years as a therapist, consultant, researcher, and university faculty member. When asked why she pursued this field, she says, I love the science of behavior and the impact I can make in the quality of lives of the individuals and families we support. She has presented her research publications and clinical experience at local, national, and international conferences. When asked what a common question she gets about her practice in behavior science, she responds, can you analyze my behavior? Dr. Nepo earned her Bachelor of Arts and Sciences, Master of Education and Doctorate in Education from Temple University. Dr. Kaori and Kathleen will be talking on video modeling and other visual strategies for individuals with ASD. We will begin today's webinar in just a moment, but know that we'll be fielding questions today at the end of the session. However, you can address your question anytime by clicking on the chat box below. When you click on the chat box, address your questions to the moderator. We hope to have your questions answered towards the end of the session. If you have any general questions about ISC or NeurAbilities, you can address them in the chat box below. There is an e-certificate of attendance for this webinar, and we will be sharing the Google link before the question and answer session. It is mandatory that you fill the link within 24 hours. Questions about e-certificates are taken on email or WhatsApp. The contact information will be shared soon. According to our latest webinar policies, participant video will be permanently stopped if it appears to be unclear or distracting. We'll be locking the meeting in the next 10 minutes. Thank you all for joining us today. Yes, Dr. Kathleen and Dr. Kaori, you can take it forward from here.
Excellent. Kaori, do you mind sharing your screen?
can share. Did I share?
Yes, that's perfect.
All right.
First and foremost, Bahat Dhanyavad to all of those who have joined us, and specifically for the IAC for allowing us the opportunity to share our research as well as our knowledge base and our clinicians. Over the past several years, we have been researching areas in the field of autism across domains, and we're happy to share with you guys some of the strategies that we found both evidence-based through our research as well as effective for families to intervene. We're going to be talking today about video modeling and other visual strategies for autism. And apologies, we're both in two different locations. So if you want to just go to slide 4, that would be great.
There you go.
All right, there we go. All right, so just a little bit of housekeeping briefly. We will have everybody on mute, and please feel free to use the chat functions. We do enjoy webinars that are interactive, and we enjoy interacting with a lot of our participants. Having said that, there's a lot of people on this particular WebEx, so we thank you for joining us, and we will leave time at the end. We will also make our PowerPoint available to the group at IAC. We do have some embedded videos in here that could be very useful tools for you after we go through our presentation. We may not get to all of the videos right now, but you guys will have access to see some of the videos throughout. So first and foremost, very important for us to talk about, as behavior analysts, we like to define things. So before we even get started, I'd like to occasion this with what exactly it is that we're speaking about. So visual strategies, how we define them, are supplemental supports using visuals, obviously as the name suggests, such as pictures, drawings, photographs, objects, and or written words. And in the context of working with children and adults, excuse me, with autism, we have to go back to the main features of what constitutes an autism diagnosis. Our individuals have challenges interacting socially, using and understanding language, having limited interests and or undesirable behaviors. Visual supports have been proven to be effective in addressing all of these particular areas. And it just makes sense that if language in and of itself is one of the core components of the diagnoses for autism, utilizing visual supports along with language or supplementing some of our language with both instructions as well as laying out teaching strategies is only going to help our individuals with autism gain access to both the curriculum as well as moving forward into independence. So I'm going to go ahead and put up some visuals here. You know, it is not unique to individuals with autism using visual strategies. So I'm sure everyone on this Zoom knows that there's many different ways that we have accommodated our own life. I myself wear an iPhone, and I get a visual as well as an auditory prompt on a regular basis that what is coming next in my schedule. On a calendar, we color code things sometimes. The Outlook in and of itself is a visual strategy, but even back to, some not so technical aspects, visual strategies such as highlighting text when we're studying, we use all of these. These in and of itself help everybody organize themselves across their life. For our individuals with autism, however, it becomes essential that we utilize strategies to help remediate some of the deficits with individuals with autism, but furthermore, also allows us to create an independence so that we don't have, mom, dad, teacher sitting behind our kids' shoulders to prompt them constantly. So the use of visual strategies really does open up independence long-term. So I'm going to pass it over to Kaori and let her take over to talk about some of the other visual strategies specific to children with autism.
So good evening, everyone, and we are happy to be here. Thank you for joining us. And as Kathleen mentioned, where you use a lot of visual strategies in day-to-day basis. The same strategy also you can use for teaching tool, including flashcards and prompting, and functional communication training, token economy, visual strategies, and video modeling, and self-management. And we'll go over these strategies with you today. So the flashcard, where you use and you can use for the teaching, and we use for tool for the teaching the foundational skills. You can present visual stimuli, provide repetition of the trial to promote skill acquisition and fluency. And fluency is meaning competent performance with combination of accuracy and the speed. Have you driven to work and without realizing how you got there? And a lot of the time happen in the morning for me. And if you're fluent in driving, you don't even have to think about each steps, like, starting the car and putting seatbelt on, and somehow you get there safely. So if you are fluent and you become more likely to maintain those skills. So when you are teaching a skill to children, you also want to build those fluency. And the flashcard will help you to build a fluency for children when you're teaching the skills. And you can also teach other skills using fluency, visual discrimination, teaching associate skill like labeling. What is this? Matching pictures and photos, and category, sorting the picture. What does this belong to? And the functions. What do you do with knife and forks? What do you do with pencil? So these are the example, and you can see, and those strategy will be useful to teach skills to children. So to use the flashcard effectively, you want to first identify the target skill, which skill you want to teach. And then gather visual. Do you want to use photo, drawing, textual, in combination with the text, with pictures. And also you want to figure out the presentation of those stimuli or pictures. You want to use on the tablet, you want to use drawing, do you want to use photo? And also promote quick responses. As you may know, children with autism tend to get stuck with routine and the sameness. So you want to make sure prevent the error while you're teaching new skills. In order to prevent those errors and teach quick responses, you can use visual strategy to prompt correct responses. The one way is using salience. Salience meaning you want to make the correct response or card standing out from other stimuli or cards, which is increase the likelihood of the correct response by achieving salience, may prevent errors, and support skill acquisitions. So looking at these pictures, and which one standing out? Triangle, because of size. How about this one? Because the color number 5 is standing out. How about this one? The instructor pointing out the blue card. So again, this is standing out. These are the salience. So you want to use those strategy to teach the correct response from the beginning. The other way is a positional prompt. Again, it is increase the likelihood of the correct response, prevent errors, and I will show you the examples to make sense. So this is a student in the middle, and the green card is more closer to the student. So student will more likely to pick the green card, which is correct response. So you can manipulate how you lay out your stimuli. The next one is the stimulus transfer, which is you pair with a new stimulus with acquired stimulus or non-stimulus, and then slowly introduce the new stimulus. Again, teaching the correct response from the beginning, and which prevent errors. Looking at the example, so you can see the apple, picture apple, and the word apple. So you can see the fading picture apple slowly, and the superimposing the word apple slowly. So eventually student learned word apple. Second bottom example is writing letter A. So initially with model, you trace over and slowly fade out this model. And then eventually a student will learn how to write the letter A without the model. So in order to implement this prompt effectively, first you need to decide what kind of prompt you need and what level of the prompt you need, and then create the prompt as quick as possible. Because you want to teach the skill and also promote independence. You want a student to learn independent response. So you want to create the prompt as quick as possible, so promote independence. With functional communication training, FCT, first you have to identify functions. Why the student having behaviors? A lot of the lack of the communication associated with challenging behavior or undesired behavior. So based on the function, you want to teach how to communicate with effective reducing undesired behaviors. So there are a few types of the functional communication training. You can use symbol exchange, picture board, technology-based communication system. With symbol exchange, students learn, exchange those icons or pictures and express their needs and wants. And also sometimes make a comment to initiate social interaction. With picture board, you have the board of a lot of pictures, and the student will learn to point these pictures, how to communicate. There's a lot of technology-based communication app, and with this, you place in the icon, and a lot of the time, those communication systems actually auditory express their need, and because audio is matching with those pictures. Again, goal is they can communicate independently. Oops. So the tips are for this functional communication training. You need to identify function first. Why is the student having some challenging behavior, undesired behavior? And you want to also provide a lot of opportunity for student to communicate. You can put the favorite snack in a container and the student can open. They can see the snack, but they can open, so they have to communicate and express what they want. And also you need to determine the system, which system going back, and which system will be appropriate for the student, maybe symbol exchange, picture board, or technology based. And you also figure out what kind of photo, picture, or symbol you want to use. Make sure the student can discriminate those pictures and photo and symbols. The next one is key. It is really critical for everyone to be consistent. A lot of time we'll see like sometimes students can communicate at school, but not at home. So everybody has to be consistently implement and setting opportunity for the student to communicate. And the size of the system, that's my pet peeve. And for the communication, if the student have the, enough dexterity and fine motor skill, I recommend to use the smaller system, because carrying all the iPad all over the place, and a lot of time they have to put that on the counter to request. So that if you have a small system like a smartphone, you can put in the pants pocket, or you can put in a purse, so it will be more accessible. And the other point using a smaller system is they don't stand out in the community. In the community, they can everybody on the cell phone, and so you want to make sure the student fit into the community. So the token economy, you want to list, figure out the list of target behavior first, and then figuring out the tokens. What kind of token do you want to use? Point and stickers, and also determine the backup reinforcer of what they want to work for. Token economy is a great way to set expectation and promote a desired behavior and decrease an undesired behavior. Tokens that prevent satiation, meaning a student doesn't get tired of getting the same reinforcer or reward over and over again, because child have to earn all the token before access those reward. Here's an example. You can use stars. You can cut up the piece of the item they're working for. And the top two in the middle and the right are the technology-based token system. You can download it to the smartphone or iPad. And you can simply use the check marks on the bottom. So again, in order to use the token economy, you have to first identify the target behavior, what behavior you want to increase, what behavior you want to decrease. You want to figure out which kind of token you want to use, check marks, stickers, points, or technology-based. Identify the backup reinforcer reward, what kind of item they want to work for. And determine the exchange procedure, when they can access to those reward, and how they're going to exchange those, cashing out those tokens. So the next one is the visual schedule. Visual schedule depicts the sequence of the event, and with icon, photo, you can also use the pictures and the real object. So set the expectation for the student and prime them in what's coming next, so they understand what's in the schedule, and which decrease undesired behavior. So you set the expectation and also prime them what's coming next, and also promote independence. There's a few types that you can set up the picture schedule or visual schedule with pictures, picture with text, textual schedule, activity schedule. So this is the example of the pictures. You can see what the student have to do. First, you have to put underwear on, jeans, socks, then shirt and shoes. These are the example of the picture with text. You have, you notice like in a picture with a word in it. On the left-hand side, it's more printed out pictures, and students have the schedule on the left-hand side. And after they complete each task, they will move those pictures so they know what's coming next and what's completed. On the right-hand side, you have technology-based schedule. You can also set up those with pictures and text. This is just textual for the more advanced learner. If they can read, you can get rid of those pictures. Again, there's a technology-based app available. And also you can just type it up or write down what they need to do. So this is an example visual activity schedule.
Start your schedule.
Just going to make a comment here. Please take note of the lack of language that the therapist is using. The schedule here and the visual actually allows the student to be independent, moving from one to the next to the next. It is easier for us to fade back the visuals than it is for us to fade back the therapist, prompting what's next, what's it time for, using all of that language. This allows us to create opportunities long-term for independence. Go ahead, Kaori, sorry.
Right. Oop. I guess the video went out.
So while you're pulling that back up, I just would like to make a comment on the visuals that we utilize and everything that Kaori is going through. The entire goal is to provide the supplemental supports that become more natural so that it is supports that we can become independent with long-term. Many of these strategies we start off with very, very early on, and then we develop them and make them more and more complex as we move forward. All the research suggests that pairing the visuals and then fading them out does in fact assist with creating independence, but it also creates opportunities to gain skills and garner skills. The individual can garner skills more rapidly. And we limit the amount of language that the individual actually has to comprehend. So the visuals do assist with that. And then this is now my turn. So excuse my excitement and my passion. I get very excited about talking about video modeling. First, I think it is, video modeling to me, the technology that has come out over the last several years with being able to video and create on the fly videos for the students that we work with on a very regular basis has made our jobs much, much easier. But alongside of that, it actually assists with training everybody else in the individual's environment. It is much easier for me to teach a parent how to implement a video modeling teaching protocol than it is for me to write something out and have somebody read through and get their thesis on trying to make sure that they're implementing certain strategies. Video modeling makes it much easier for families long term. So I do get excited about that. So what video modeling is really the visual of watching a video on a step-by-step, illustrating behaviors that we want to see for the individuals that we're working with via video. It does in fact promote skill acquisition. We typically use it as a teaching tool, but it assists with skill acquisition. It allows repeated exposure over and over again, and it allows it across different environments, especially if we teach families and caregivers how to implement the video modeling protocols. We can use it across settings, and it works for all ages. I mean, even for my own personal life, I use video modeling via YouTube whenever it is I want to do something pretty that I don't know how to currently do. Right now, it's learning how to do salsa, which I'm terrible at it, but I get to watch the video repeatedly and go over step by step by step. It's no different for our children with autism. We just look at the skills a little bit differently. Oh, sorry. So there's several different ways that we can use the video modeling. One is by simple prompting, providing a prompt at the beginning and allowing the individual to watch and prompt through. And then we can stop the video, start the video, all along the way in every step. The same thing with video modeling. We also use the self as a model in some respects, meaning we teach the individual to do a specific skill, and then we video them. And some of the children that we work with really enjoy watching themselves. They also enjoy hearing themselves get some of the positive reinforcement when they themselves are the star of their own video model. Sometimes we do use peers as a model as well. Same age, we try and keep it yoked directly to the developmental milestones that the children that we're working with are. And we ask a peer or even a sibling in some respects to be the model and to walk through the particular task. I don't love doing the instructor as a model because I feel like they hear us talking over and over and over again. Having said that, when we provide the positive reinforcement, we become ourselves a reinforcer, and seeing us in different settings on a video sometimes actually is very beneficial for the individual. It also is the easier one to do if I want to break down a task very, very specifically. And then the point of view is really videoing from a particular what the child should see, what the child would see. And we have some examples in here. So I'm going to scoot along, and this particular one is video modeling for brush the teeth. I'll let it play so you get the gist of it, and then we'll move on. Kaori, I think you have to unmute.
Dr. Kaori and Kathleen, I just need to interrupt here for a moment. Basically, there's a technical issue that we are facing. So our chat option is being disabled. So we are not receiving any questions right now. So I request all the participants to not direct your question, not to try and direct your question to Sandra or to me. You already have the India Autism Center's WhatsApp number, and I will direct the questions to Sandra on her email. So if I'm just spelling out the WhatsApp number for everybody to note it down again, it's +91, the code, and then it's 905 111 0656. I'll repeat again, the number where you need to address your questions that you want the moderator to ask the presenters. Please address your questions to this number. +91 is the code, and then 905 111 0656. Thank you, everybody.
Well, thank you. I didn't realize the chat function. I just thought we weren't very interesting.
No, completely not. Yeah.
So I'm going to go ahead and play
Under the
so
water.
an
Away.
example of brushing teeth for video modeling.
Now I shut off the water.
Make note of the very discreet
And I
steps.
Toothpaste and put it on the head of my toothbrush. I closed the toothpaste and put it back. Now I am ready to brush my teeth. First, I brush the teeth on one side of my mouth on the bottom, making sure I brush the outsides, the insides, and tops of all the
Notice
teeth.
how discreet the language is also with the instruction.
I brush
If
them.
we're going to use language in the video models, it has to be very discreet, and we have to be very attentive to how much our individual or our student that we're working with, how much they can actually comprehend. So oftentimes we'll make very differentiated video models, really tailored individually for the child that we're working with. Some video models don't have any language at all. Some might actually have just arrows that are pointing. Some are just watching step by step in a very slow format. Again, it has to be tailored individually for the child that you're working with, but it is very, very easy to make some of these video models. What we would typically do after this is, once we show the individual the video modeling, we would then practice it. We would practice step by step and watch it again. And then we can use different steps. We can pause, we can go back, we can continue to use the prompting of the visual rather than me as the parent or the therapist consistently saying, next step, and now what do you do next? Or pick up the this, or do the next thing. It's very, very difficult to fade back those instructional languages. This is much, much easier. And like I said before, this is very natural. These videos can get more and more complex over time. So the key is to practice some of these and to break down the tasks in a very small, discrete steps. We generally speaking, we call it a task analysis. So we try and break down in a visual format each step. Pick up the toothbrush, turn on the handle. Sometimes we even get it a little bit more fine. Turn on the handle with your left hand and open up the hot water. On your right hand, open up the cold water. Test the water. We may even get down that fine minute. Again, it really depends on the individual that you're working with. But the iPhone, thankfully, allows us a lot of opportunities to make different videos and to assist our individuals. So this is another example of a video prompting for, and this has very little language in it, about putting together pieces of a puzzle. Notice in this one, the lack of other stimuli. There is just the pieces, there's a hand, and there's actually no verbal cues in this particular one, but we're showing each step, piece by piece, putting it together. What we would do then is use it as a prompt and sit it next to the individual. If we need to, we would do hand over hand prompting to show, to pair that constantly with the video in order to create more success. Again, our job here and using the visuals is to create the least amount of errors possible. And video modeling in and of itself can be that prompt that for me as the therapist, I can be quiet and use the prompt and the video to teach the particular skill. It also allows me to reinforce. Very often we're saying the same things over and over again. Good job, well done. It gets lost sometimes. Our verbal praise gets lost in our instructions. So I know my own children get tired of hearing me give them instructions, and sometimes they end up ignoring the positive reinforcement. When we use the video prompting, we can limit our language enough, and that actually increases the salience of me saying, good job, well done, stupendous. Oh. So here's an example of a self as a model, meaning we use the individual that we were working with. I can tell you, they love this when we get to a certain point, especially our young ladies. They like being on camera. Now she's going very rapidly. We started off with appear as a model for this individual, and then we moved on to saying, okay, it's your turn now. Especially right now in COVID, it's very important for us to teach the children to wash their hands on a very consistent basis. And sometimes our children have sensory issues. So we taught the hand washing skill using a peer as a model. We provided reinforcement. And then this actually was part of her reinforcement to be on camera doing it herself. Now we can use it as both a prompt and a reinforcer, because what she'll do is she'll sit with her iPad and watch it over and over again. And then she'll put it down and walk over to the bathroom and go wash hands, you know, unprompted, so to speak. It's a little prompted, just to be fair. All right, appear as a model. This is sometimes how we have to start out, especially if we have typically developing peers who would be a model for us to teach.
With the doctor's kit.
Play
First,
skills are very
open-
important.
Katie takes out the stethoscope. She puts it in her ears. Katie
So-
listens to Teddy's heart.
A lot of our social skills and our deficits in social skills can be remediated in some respects with at least putting out a peer as a model. So it's hard to teach a child to play appropriately when you're an adult and you're playing with a child. It's not very natural. Yes, we do it. Yes, we role play, we model. Having said that, having a peer as a model and imitating another peer is one of those essential components. Using the video modeling and a peer as a model gives us that opportunity to teach children how to imitate their peers. I find this to be one of the most successful in teaching some of those basic play skills, especially very early on, where we're able to show the model, we provide reinforcement, we prompt the individual through these different play tasks, and then we show the model again. What that typically does is that allows us a model, and then we can do it in the natural environment. So I always say it's in vitro, and then we move to in vivo and provide the reinforcement. But again, here, what we want is we want the individual imitating their peers. Imitation in and of itself is a huge skill for our individuals with autism, and that can allow them to develop long-term skills over time, all the way up through adulthood. So if we start early on with teaching them how to imitate from what their peers are doing, the good stuff, by the way, we want them imitating the good stuff. You know, when it gets to teenage years, I can't help you, but at least early on, you know, we want them imitating the very clear play skills. This has always helped us with the social skills and sometimes the communication skills. Again, it allows us to pull back as therapists so that we're not the ones constantly providing the prompts. It is not natural for an adult necessarily to teach a child how to play. It is natural for a peer to show and teach a child how to play. And this is the last one with the instructor as a model. Notice the no language when the instructor's in there. Very discreet, zoom in. You do want to see the lay of the land. You want to be able to see all the materials that you're going to be working with, but you want to come close up when you need to come close up. And oftentimes this particular one would be stopped in snippets. We would do one step, then the next step, then the next step. We might show the whole video first and then show parts of the video as they start to put some of the pieces together to make some kind of really cool dragon.
It's fish.
It's a fish. This is why adults should not teach play skills. So moving on, the video modeling and all the different areas that we can use video modeling is by far one of the most innovative things that has come out over the last five to 7 years. And the research supports continued use of it. Oh, here's the last one, which is the point of view. And the difference here is what you want to do is you want to get as close up and almost make it like you're the one looking exactly at it. So you are showing the child what the child should be seeing. So you're not seeing any distractions. You're only seeing what the hands would look like as close up as possible. And this is considered the video model point of view. I'm not going to make you sit through all the beating, but you get the concept here that there's many different opportunities to use the video models to teach basic skills. Again, it comes back down to your learner. It comes back down to knowing the individual. How far do I have to break down the steps? How much videos should I use? And I always say, just start with one at a time. You know, hand washing and toothbrushing are always, I always say it's the easiest, but as a mom, I know it's definitely not the easiest to get my kids to wash their hands and brush their teeth. But it is the easiest, most discreet. I know step by step as anybody that I need to turn on the water, I need to use the soap, and I need so forth and so on. You need to know your individual, break down the task, and make it appropriate for them. But again, the video model is really just, it's exactly what it is a model to show the individuals what they should be doing. And then your job as the therapist or the parent or the caregiver behind the scenes is to provide that positive reinforcement, not to continue to verbally prompt, but instead allow the video to be the prompt and you be the positive reinforcer behind it, you know, making sure to solidify that skill. Yes, that's right. Some individuals need the verbal praise step by step. So when you saw the videos earlier, there was very little language in there. Oftentimes we start putting, you know, yes, that's right, good job in the middle of the steps, but we do have to fade that out because we want to chain that behavior all the way together. You know, so that hand washing isn't a series of 12 steps. It's, you know, wash your hands. And at the end of hand washing, it's like, hey, good job washing your hands. So the basic tips here are, we need to always identify the skill. Break it down into what sequence is most appropriate and what is the existing sequence. What would normally happen? Moms sometimes, including myself, often want perfection. You know, we want it to be the best of the best. The video model can be the best of the best as to the best sequence I could possibly see. But sometimes, you know, in real life, that's not really what happens. Sometimes, you know, when I'm making something in the microwave, it may explode and I may not clean that up. And sometimes you have to just allow that to happen, some of those mistakes, because at the end of the day, what we're trying to do is create independence and one skill at a time. If we make a mistake in the middle of an existing sequence, and we have to put in more work, like, oh, you're gonna have to clean that up now. We kind of broke down the skill and we didn't take it from front to back. So my one big tip, especially for my moms out there, is that let mistakes happen. It's okay to have mistakes happen. We wanna get through the entire sequence until the end where we can provide the positive reinforcement. We can always have dad clean up the microwave, it's fine. So again, know your individual. Determine the video and then create the video with whatever resources that you do have. There are some individuals that don't do, some technology limited individuals that we do work with who don't have, you know, the videos from the iPhones. What we sometimes will do is we might print out pictures of each of the steps and use that as our visual. So don't fret if we don't have all the technology that's around. We can, you know, modify it and we can use different visuals. But the overall concept is to show the step-by-step all the way through and then provide reinforcement. On to self-management. Visual strategies are typically used for a lot of different self-management skills. We use task lists, calendars, visual schedules. We use our watch, we use our phone. What I find interesting is the amount of visual supports I personally use, and I see, you know, my colleagues and professionals use. It's an immense amount of visual strategies to even manage my own personal executive functioning, everything about who I am. But yet we limit it with the individuals that we work with autism. We kind of expect them to not necessarily use supports or not need the additional visuals, which is kind of counterintuitive. So if we recall, you know, the major diagnosis features of language and everything related to autism and the diagnosis of autism, it only makes sense to be able to teach our individuals to use the visuals, use the natural environment, whether it's, you know, teaching a skill via video modeling or providing supplemental visual supports. These are the types of things that we need to put in place. But again, I always think about, you know, when they're 25, when they're 30, are those same visuals going to be functional then? Or do we fade them to be something that's a little bit more useful and more age appropriate, like what we use? So we showed some of these already. So the key is to find systems that work for the individual. with the goal of independence. I always say that every child, if you've worked with one child with autism, you've worked with only one child with autism. Every individual is distinctly different. What is not different is the basic principles of behavior. You know, individuals will seek out reinforcement and will avoid things that are not so great, you know, avoid things that are a drag, access things that are cool. That's the basics of all that we're looking for as individuals. I know it's a little bit more complex than that, but that's what we should be looking for our individuals with autism. You know, how do we get them to access things that are cool, appropriate, and how do we get them to avoid things that are a drag and shape towards independence? And the goal is to create an environment where they'll access naturally occurring reinforcers. That's where the visuals do in fact help. You're not going to always have somebody behind you saying, great job. You're not going to always have a teacher prompting, or at least we hope not. The visuals allow the therapist to fade back, and it allows an opportunity for the individuals to be a lot more independent long-term. So, and that is the extent of our visual strategies. So we just gave you, 10 years worth of research in 45 minutes. So we scooted through a little bit fast. So thank you for your patience. Next week, we will have another one with Jennifer Schwartz and myself, out with the old and with the new, selecting and reinforcing appropriate behaviors. So I would love for you to join on that one. That's also something that is near and dear to my heart. And here's some of our information here, and I'd love to open it up, Sandra, for questions if we've gotten any. And if not,
yes,
for the
thank
comment.
you, Kathleen and Kaori. I appreciate that presentation, and we have a few questions. I'm going to dive right in. Is a video model useful for children with autism who have hyperactivity issues?
Oh, that is a dangerous question. Do you want me to take that one, Kaori?
Yeah.
And what I mean by dangerous question, hyperactivity in and of itself is a behavior. I would say that hyperactivity, we need to understand the context of when, we have super balls here in the United States, and a super ball is one that you drop from like a small distance and it bounces up and it goes all the way around. I always say that that's some of my kids with hyperactivity. They're just a big, bunch of super balls just jumping all the way around. That in and of itself is a behavior. Can a video model assist with that? Absolutely. But we also have to remember there's contextual variables. When do we get hyperactive? What's going on when that behavior is occurring? What happens right after? So we have to look at the behavior first and say, why is this occurring? Is it occurring to get out of doing something that we don't want to do, which sometimes that's the case? Or is it occurring because I have nothing else to do and I'm accessing all kinds of fun things? You could use a video model, but remember, a video model happens at the front end of behavior to teach a specific skill. So the reason I said that's a little bit loaded is because sometimes hyperactivity is occurring for many, many different reasons, and you have to figure out what the purpose of that is first, what that function is for the individual you're working with before you back in and say, oh, well, now I'm going to use a video prompt. Having said that, we have used video models for showing the appropriate thing to do in the right context, and we teach that. Meaning if we're in school, we might show a video model of, how to raise your hand and sit down and the appropriate behaviors, and then we reinforce those appropriate behaviors. If in fact that's what the hyperactivity that we're referring to. So the answer is both yes and no. First, figure out what the purpose of the behavior is, then identify how I'm going to teach the alternative, and then you can use the video model. So I'm sorry it's complex, but it is behavior.
Okay, great.
You want to add anything to that one?
That's great. And we had a similar question as well with an older child of 19 with a short attention span and can be very aggressive. And how do we implement the video modeling without him running away or getting aggressive?
Okay, so the aggression, again, we want to analyze that in and of itself and say, why is the aggression happening? I don't want to armchair consult on the aggression, but what I can say is the attention to the video model. It has to be rewarding. It has to be something that I want to see. It can't be that thing where I show you this and then I'm like, do it, because that's going to actually defeat the purpose. The kids that we work with, we start conditioning very early on that if I look at this thing on the video or even a visual, I then get something good from the person who's, you know, behind me, my mom, my dad, my teacher, my therapist, anybody in my environment. They immediately are like, oh my gosh. So it really makes the video more positive very, very early on. What I don't want you to take from this is that you make a video of what you want to see, and then every time there's aggression or hyperactivity or, you know, something that you want them to do, you show it and say, okay, we're going to do this. That doesn't work. That's definitely more what we consider to be more aversive and more punishing. It has to first be valuable to the individual. So I used early on with some of the individuals, their interests. I might use a Lilo and Stitch Disney character, and we might start watching the Disney characters, and I might start pointing different things out and breaking different tasks down. Using the individual's interests is first and foremost if we can't get them to sit and watch a video. A lot of our kids just like sitting and watching the iPads. But if it's something that I want them to attend to, I have to start early on with attend to small little bits of time. I'm going to make it interesting, and I'm not going to make it work early on. I'm just going to make it, hey, isn't this cool? And that does take a period of time. So for older individuals, especially teenagers and beyond, start small. Don't expect something very, very huge. Start very minute and use a skill first that the individual likes to do, something they already know how to do. Take the work out of it. Watch the video and say, oh my gosh, you already know how to do this. Then they do it. And then it's like, oh my God. And I always call it like the celebration. Very clearly, I have a lot of affect and I get very excitable. You have to get very excitable. You have to be willing to make a little bit of a fool of yourself sometimes to make the videos interesting, to make the visuals interesting, to have that individual connect. So the answer is yes and no. Yes, but don't use it as a consequence.
I have a few comments on that one as well. Like, you know, like Kathleen said, like, you have to find out the function of the aggression. Why is that aggression is happening? What happened before and after? And maybe they don't know how to communicate. So you might have to address that. Or if you're concerned about using technology and watching the video, maybe you can use a visual schedule with pictures and a favorite character and stuff like that. So that will be reinforcing. So maybe you get stuff from there and move to the video modeling, because you can set up the same sequence with pictures, and so you get stuff from there. And that heavily reinforce while they are following the schedule.
So it could really vary from child to child.
Exactly.
Based on what's reinforcing for that child. Okay. In the case of peer modeling, what is more effective, or which would be more effective, using peers who have autism or who do not have autism?
Terry, you want to take that or you want me?
Good question. Depends, like, you know, peer as a model, probably familiar peer will be more reinforcing for the child, and maybe siblings, and not necessarily have to have the diagnosis. And so we depend on, like, you know, which individual, like, you know, they're gravitating towards will be the better.
Yes. I always say that, you know, kids are kids. Kids like watching other kids. They like watching other kids that they can connect with, and they don't connect with diagnoses. They connect with children. So it should be somebody in their environment or somebody that they've had interaction with. It shouldn't be a bully, and it shouldn't be somebody that you don't like, unless they do a really poor video and we can use it to teach them how to make fun of those individuals. But that's not the purpose of today's talk.
All right. Can you explain delayed gratification in a token economy?
Sure.
And that's Kaori.
So, like, you know, when you are using token economy, you have to earn, like, you know, stickers or check marks. And so you have to earn like 5 or 10, whatever the predetermined numbers. And that's why, like, you know, it's delayed when they are access to reinforcers. So not just like right after they perform like one task, they have to wait until they earn the 5 or 10 tokens, and then they can access to the reinforcer.
Okay, thank you. Just a couple more questions. Would video modeling be effective for nonverbal children? Because they may get distracted. Okay. And here's an older child. Would video modeling be effective for teaching activities like being out in the community, going to a shopping mall, riding on a bus? Okay.
Definitely, yes.
I think that's all the questions we have so far, unless you have anything else to add.
I do not. Thank you, everybody who's joining, and thanks to the India Autism Center for giving us the opportunity to share.
Thank you, Kathleen, and thank you, Kaori. I'm getting a lot of messages on the WhatsApp. I'm really sorry this chat box is not working. And we're getting wonderful messages about how well the presentation is and that they learned a lot. And I'm flooded with messages and questions, but we have a time cram. So unfortunately, I can only pose a few to Sandra.
Well, and we can always, Andrew, if you want to get some questions that we can also answer via email, we'd be happy to do that.
Okay, then I will surely send the email IDs to the participants while sending out their certificates, and then they can pose it directly to you.
Excellent.
Wonderful.
Thank you, everybody.
Thank you for joining.
Have a wonderful evening.
I will close out by thanking the participants for tuning into the Autism Specialty Care Education Series brought to you by the India Autism Center and NeurAbilities Healthcare. And if you would like an e-certificate or to leave feedback, just fill out the Google form attached and we will send your certificates within 4 working days. The form link is only valid for 24 hours, so make sure you fill it out. In case you're unable to fill out the form, you can reach out to us via the WhatsApp or email us at info@indiaautismcenter.org. If you would like to stay updated with other webinars, please follow our social media handles or the link to the WhatsApp group. The recording of this webinar will be available on both of our YouTube pages within about a month of the webinar. We look forward to your suggestions. We hope to see you next week for our final webinar in this series. And now we will stay back for a few minutes to answer any questions. And we thank you all for coming.